So, good morning, people. And today I wanted to talk about mast cell activation syndrome and the different receptors that there are for histamine, because there are some that are very well known. The typical symptoms of itching and, asthmatic symptoms, all that kind of stuff. But, in mast cell activation syndrome, mast cells become overly reactive and inappropriately release excessive histamine along many other things like prostaglandins and so on, and inflammatory cytokines. These histamine triggers four main receptors systemically, like H1, H2, H3, and H4. Treating mast cell activation syndrome, it's going to be a combination to suppress this histamine, right? But also to find the root cause of what's causing this, whether it's, Lyme toxins, parasites, whatever it is. This biosis, SIBO, all this. So let's go. So H1 receptor. H1 receptor found throughout the vascular system, nerves, respiratory, gastrointestinal tract. When activated, it causes allergy-like symptoms such as flushing, itching, hives, headaches, bronchoconstriction. This is, I guess, the best known um, receptor and symptoms that are associated with histamine. But obviously, and the reason why I wanted to make this video is because there are more. Like H2. H2 receptors are concentrated in the stomach lining, but also found in blood vessels, the brain, the heart. They primarily regulate gastric acid secretion and control dilation and blood vessels. So yeah, in this case, they usually use Pepcid and that famotidine and that kind of stuff. Because obviously there is not enough acid, which is very badly understood. Therefore, you might have acid symptoms, and that kind of stuff. But it's a mistake to assume that you are having too much acid when in fact you're lacking it. But yeah, that's another story. H3 receptors, found mainly in the central and peripheral nervous system. These receptors act as autoreceptors, regulating the release of neurotransmitters in the brain. They are closely linked to neurological symptoms like brain fog, sleep disturbances, and so on. I mean, again, the little thing known about histamine is that it's also a neurotransmitter. Therefore, when you have histamine inflammation, mast cell activation syndrome, from toxicity, from Lyme, from whatever it is, it's going to affect the brain. This is exactly what happens during PMS because, again, estrogen rises, histamine, and the other way around. So when they fluctuate, they affect mast cell activation syndrome, mast cells, and histamine flares, and then you get headaches, bad mood, depression, crying, anxiety, panic. All these symptoms are because of this, not because you are, too emotional, whatever. Um, yeah, this part is not known, and I remember I had like anxiety for a long time, and it was just bizarre because I would feel it first in my eyes. The eyes were burning, then my legs would feel weak, but I was not anxious for any reason at all. So I didn't understand why on earth I was having these kind of symptoms. Another horrible symptom that this receptor can cause with all this combo is what they call depersonalization, derealization, where you just feel like an outsider to like if you were watching a movie. This is absolutely devastating and horrible. And yeah, but if you're living this, I mean, this is why, and you can do something about it. And yeah, and usually underlying these issues is there are things like Bartonella, toxicity, SIBO, blah blah, and yeah, much more parasites and so on. So yeah, H4 receptors highly expressed in white blood cells and tissues involved in immune regulation like the spleen, bone marrow, thymus. They are heavily involved in inflammatory responses like itching, recruiting immune cells to areas of allergic reaction. So this would be the four, but so once again, it's not just the asthmatic itching kind of symptoms, which, by the way, I rarely have. I might have the breathing ones, and I had them in the past, but I never had skin ones. So it's weird because many people do not have these ones, but they have brain ones. Um, and therefore, they're looked at if they were not, which in fact they are not. They're having an histamine allergic response in the brain and nervous system because of these receptors flaring. So, this is very important to understand. And again, I get very angry when they call these things mental when they're not. You're having an allergic response. It's just that it's not happening in the skin, it's happening in the nervous system, in the brain, and causing all these horrible symptoms. Yeah. So, yeah, to treat all these, obviously, you need to have to go to the root cause. And in women, liver, making sure the liver is working properly, and putting the hormones as good as you can, because again, as progesterone goes low, histamine rises because the estrogen gets, like, usually, even if it's low, it's higher than the other one, and this lack of equilibrium flares mast cells again, and then this, yeah, it's like a loop. No, so for women it's a lot harder to come out of these diseases, you know especially after 30. No, so yeah, that's what I wanted to say, and make very clear, because many people do not know. The pharma horrible industry takes advantage of this big time, which is absolutely horrible in my opinion. And sometimes they give things that, yeah, that they are antihistaminic in nature in their chemical composition, but they are not telling you. But when you stop them because you haven't dealt with the root cause, guess what happens? Boom, you get like a bounce back of all this inflammation back to you, and you get worse. Therefore, you cannot quit the meds. No, that's the trick. So be careful with this, and just know that these are the different receptors that happen, that get activated, and they express this way. So you know what's going on, and because it's overwhelming, it's really overwhelming to get so many symptoms all over the place, and especially for those that are affected by this, especially the H3 receptor and all this nervous system brain stuff is just hard, let's say. No, especially when they are women and they are seen as weak sometimes, when in fact we are like bloody warriors, but that kind of thing. So yeah, that's that's it. That's what I wanted to say. Thanks for watching. Have a good day. Please subscribe. Bye.